Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Clinical features of rickets. The main clinical features are the child can have craniotabes. Craniotabes is the softening of skull. Craniotabes is the earliest feature of rickets. Craniotabes can also be seen in osteogenesis imperfecta, syphilis, or hydronephrosis. Other features are there can be frontal bossing, delayed closure of fontanelle, hypotonia or pot belly. There can be rachitic rosary or pigeon chest deformity. In pigeon chest deformity, there is anteriorly displaced sternum is seen. There can be Harrison groove or sulcus, atelectasis or recurrent chest infections can occur. There can be widening of the wrists or bowing of legs can be seen, especially in the soft bones. There can be valgus or varus deformity. Wind-swift deformity is seen where one leg is in varus whereas the other leg is in valgus. The child will also present with alopecia. Alopecia is mainly seen in vitamin D dependent rickets type 2, and lower extremities are mainly involved. Lower extremities like vitamin D resistant rickets. Lower extremities are mainly involved in vitamin D resistant rickets.
thank you and thank you for watching.